Good afternoon, everybody, and welcome to Local Impact Ottawa Valley. My name is Trevor Riley. Now, as everyone's heard, the afternoon on the 21st of December, Ontario will be heading into a lockdown at the end of this week, and there are two stages. There's a 28-day lockdown for most of Ontario, and then the northern regions will be put into a 14-day lockdown. Dr. Robert Cushman is with the Renfrew County District Health Unit, and he joined me to share a little bit of information on what he knows as we head into the lockdown at the end of the week. Now, the big question that I have received in the last couple of hours is the 28-day versus the 2 weeks. Where do the geographical lines sit in Ontario if people aren't totally sure what classifies as Northern Ontario?
Okay, so Northern Ontario is north. So we are Southern Ontario. Unfortunately, we are in this with Ottawa and all the rest of Eastern Ontario for 4 weeks, starting this Boxing Day. So you have to go up to Sudbury before you get into the 2-week zone.
Okay. Now now when we're looking at the lockdown procedures and what is open, what is closed, to give people a perspective, at what point did we reach this? Back in, starting in March, is this something that are we going back to something we've already been in?
Yeah, it's funny you ask. Let me just put it this way. This is going to be significant, and it's probably going to be tougher because it's not, April and May, it's January and December and January. So what you're going to see is only essential shopping, and pharmacies and grocery stores will be reduced to 50%, the bigger box stores to 25%. One thing that they've said this time is they want to keep medical appointments and dentists and services like that, healthcare services, they want to keep those open. Clearly, there'll be a lot of precautions that will be taken, but those will be open because there's a big emphasis. In Southern Ontario, they're having trouble now meeting the requirements of people who have non-COVID illness. But here in our region, where we're doing quite well, we want to make sure that those who have other conditions are able to get the care we need. And we've done well with our hospitals. And yes, if you do have some health issues, get the attention you need. Don't flood the emergency room, but if you're going to go there, get some advice or attention before you go. I mean, we are waiting now for more information from Toronto, but it's clear this is going to be quite severe. The school kids, the younger ones, will be out for an additional week. I think they go back on the 11th, if my dates are right. The high school students will go back even 2 weeks later than that, by about the 25th. So there'll be virtual education in there. So this is going to be tough. They're going to encourage people to go back to maximizing working from home. I noticed that the Premier has made some allowances, some financial help for small businesses. So this is tough. I think the real question is people from Renfrew County may be saying, well, why us? And even people from Ottawa, why us? Well, what we've learned is this. I've looked at the last few cases in Renfrew County, and even the ones with outbreaks where we've had a significant number of cases, and they have all come from elsewhere. It's all about travel. So if my message is anything here on Christmas Eve, just before this lockdown, it's don't travel and don't have people travel in either. And secondly, when you do your Christmas celebrations, please keep it to a minimum in your household. And this is what we're going to have to do, and we're going to have to basically toughen up and be courageous and do our best during this lockdown. But the alternative is worse. I mean, people complain about the economy, and rightfully so. But boy, if you let this disease get out of control even more than it is now, you'll see a devastating impact on the economy. So this is what we need to do. And the Premier has made a tough call. Some people say he didn't make it soon enough, but he's getting pressure from all sides, and he did the right thing.
Now, one thing that we spoke about a couple days ago, and one message that kind of stuck with me, is we all have to do our part. And I think that is the number one message right now, heading into our second lockdown, second large lockdown. Is the message that you made that was clear. And I think that's something we need to stand by and start to believe in.
This is really important, and it's going to be tougher because the novelty's obviously worn off. We've got COVID fatigue. It's dark and it's cold, unlike in the spring where the days are getting longer. And I think my real appeal to people is, look, okay, so businesses and these venues have closed. Doesn't mean you can substitute with a party in your basement. And Mr. Ford was asked about that, actually. Why isn't he doing curfews like they had in Australia? And he said, he doesn't really believe in a police state, or he doesn't believe in a police state. And he expects people to do their part. And I frankly, I understand his position, and I expect people to do their part too. No, I think people need to look. This is a lockdown. So what does that mean? That means that basically you're in your household or you're outside apart from people, except for the essential go-to material. You got to eat. You got to go to a doctor's appointment. You need a pharmacist's prescription. But other than that, get with the program. Well, I think the good news is that we should be seeing vaccines coming to town in 2021. And as you probably know, there's some concern now about an additional strain of the virus, which has been seen in the UK of recent. And so, again, this shows you that this disease can spread rapidly, and it may be a new variant that could spread rapidly. We're quite confident. I'm not an expert from what I've seen so far that the vaccine can work in either case, but we need to really just basically tell ourselves that we got a lot of work to do between now and the spring. And hopefully by then we'll have some pretty well-established vaccine programs in our community.
And the VTAC is still going to be scheduling testing and everything like that. They haven't shown any signs of slowing down. So that's also if people are feeling now, are they still doing the feeling a need for a test, or are they still looking for symptomatic people?
Symptomatic, or thank you for bringing that up, Trevor. Actually, so VTAC is if you're self-monitoring and you have symptoms, if you're a contact, if you've been advised by the public health unit, or if you know you're a contact and haven't been advised, we all should be self-monitoring. And if you have symptoms, get tested, because regrettably, COVID has a broad spectrum of symptoms. And in this particular time, anything's COVID until proven otherwise.